maxillary major connector. There are 4 steps in designing maxillary major connector. First step is mark the primary stress bearing area and cost, that is residual alveolar ridge and hard palate. Step 2, that is mark not stress bearing areas, which one is palatal gingiva, mid palatine raphe and posterior palatal seal. Mark all these areas with different color. Step 3, mark the connector areas that are available to place the components of major connector. Step 4, choose the appropriate connector. These are based on these 4 factors, that is mouth comfort. There should be a minimum bulk and also it should avoid interference during speaking. Next one is rigidity. The rigid major connector is used for bilateral stress distribution. Then location of denture. The location of denture base is based on the area available to place major connector. The amount of indirect retention required will influence the outline of major connector. The first one is single posterior palatal bar. This is the single posterior palatal bar. It should run across palate on both sides. It is half oval in cross section. It is used as an interim partial denture. The main disadvantages are there is a poor bony support from hard palate. In this case, there is narrow anterior posterior width. So, there is lack of vertical support. To improve vertical support, we can add many rests. It cannot be used anterior to the premolar region, that is due to the tongue interference. Then, it is used only when there is 1 or 2 edentulous spaces only. It is used mainly in Kennedy's class 3 cases. Coming to next, which is single posterior palatal strap. This is single posterior palatal strap. It has wide thick band of metal plate that run across the palate. The width of the strap can be decreased depending on the edentulous span area. It should be at least 8 mm wide. Indications. It is indicated in unilateral distal extension partial dentures, Kennedy's class 3 cases. Advantages. It has excellent resistance against bending and twisting forces. It is comfortable to patient due to very thin layer of metal resting on the palate. It has enhanced retention. It has good indirect retention against dislodgement by sticky foods or gravity. It has a property of L-beam or L-bar principle, that is, the both anterior and posterior segments are connected by the longitudinal segment on each side. Due to the 4-sided closure of denture, it offers good resistance to major connector. Disadvantages. It has large palatal coverage and it cannot be placed on prominent median suture. It may cause papillary hyperplasia. The posterior border should end before the junction of hard and soft palate to avoid discomfort. The third one is single broad palatal major connector. The other name is palatal type major connector by Thompson. It is also called as anatomic replica partial major connector. It covers area between 2 or more edentulous spaces. It extends posteriorly to junction of hard and soft palate. Indication. Kennedy's class 1 cases with vertical ridge resorption, that is bilateral edentulous area located posterior to the remaining natural teeth, and with more than 6 remaining anterior teeth are present. U or V-shaped palate. In cases with strong abutment. Advantages: it has good retention due to the presence of interfacial surface tension, and it has good vertical support. Next, disadvantages: it may cause papillary hyperplasia. Next one is anteroposterior or double palatal bar. It is the combination of anterior palatal strap and posterior palatal bar. Here, in this case, the anterior strap is narrower than the posterior bar. The margins of the strap should lie on the valley, not on the crest of rugae. This area is the valley of rugae. Posterior bar is half oval shape like single posterior palatal bar, and the anterior strap and posterior bar are connected by two longitudinal elements. It gives circular configuration. The purple colored areas are longitudinal elements. It contributes to L-beam principle, that is the anterior and posterior areas and connected by longitudinal segments. It contributes to good resistance. Indications: it is indicated in cases where anterior and posterior abutment teeth are widely separated, in case where there is large inoperable tori, in cases where there is long span edentulous area, in Kennedy's class 2 modification 1 arch, and in Kennedy's class 4 cases where there is bilateral edentulous area located anterior to the remaining natural teeth. Advantages: it is rigid and strong. It has limited soft tissue coverage, so there is a complication like papillary hyperplasia is limited. Disadvantages: it has limited support from palate, and it is uncomfortable due to the tongue interference. Next is horseshoe or U-shaped connector. In horseshoe-shaped major connector, thin metal running along the posterior surface is seen. In posterior order, it extends 6 to 8 mm to palatal tissue. It is indicated in cases where there is many anterior tooth are to be replaced, in case where there is inoperable tori extending posterior to the hard palate, in case where there is excessive overlap of anterior teeth. Advantages: it is reasonably strong. It has moderate retention and support. Disadvantages: it cannot be used for distal extension cases, as when vertical forces are applied, it tends to straighten, and the greater bulk is required to avoid flexing. This may cause discomfort to patient. Next is closed horseshoe or anteroposterior palatal strap. Here, the border should be 6 mm away from the gingival margin. There should be a uniform thickness in strap, and the posterior strap should not touch the palate. It differs from double palatal bar in that posterior strap is a thin plate. Indication: it is indicated where there is numerous teeth are to be replaced, in presence of inoperable tori. In Kennedy's class 1 and class 2 cases with anterior tooth replacement. This is Kennedy's class 1 and Kennedy's class 2. Complete palate. It covers entire palate. The anterior border should be 6 mm away from the gingival margin or extended up to cingula of anterior teeth, and the posterior border should extend up to junction of hard and soft palate. Here there is loss of peripheral seal. Due to this, soft tissue tends to rebound after compression. Bending posteriorly gives slight border seal, and it also prevents food accumulation between palate and major connector. There are many types. The one is all acrylic, combination of metal and acrylic, and all cast metal. Indication: it is indicated when many posterior teeth are to be replaced. And in cases with Kennedy's class 1 condition, with anterior teeth are to be replaced. In cleft palate case with a narrow and steep vault. Mainly used in patients with well-developed muscles of mastication or presence of all mandibular teeth. And also in cases with flat ridges and shallow palatal vault where high stability required. Next is advantages. It has best rigidity and support. The metal transmits temperature better than acrylic. Then disadvantages are: it may cause inflammation and hyperplasia. It interferes with phonetics. In maxillary major connector, beading is done. It is done mainly in posterior margin. It provides better seal and keeps denture in position. And also it prevents entry of small food particles. The beading is created by making 0.5 to 1 mm groove on master cast using spoon excavator. And it should thin out 6 mm near marginal gingiva. In most cases of maxillary major connector, relief should not be given unless there is palatal tori or prominent mid-palatine suture.